Hey everybody, this is Wadi, and in this next video we're going to be describing the steps and setup for a single port robotic right colectomy. So I'll have the robot coming in from patient right. Usually I have the robot coming in from the side of the anatomy. The patient will be positioned supine. I'll have the arms tucked, although you could probably get away with having one of the arms out if you really needed to. I usually put a Foley catheter in for these cases. My incision is 3.5 centimeters. I use the large SP access port for these transabdominal cases for most of them. And the incision really is surgeon dependent. So you could have it be midline supraumbilical, infraumbilical, midline, or you could have a fan and steel incision as well. For my instruments, I like to use a Cartier, a fenestrated bipolar, and monopolar scissors to do my exposure and dissection. You're going to need a needle driver, a Rosie, and as mentioned, a large access port. Pneumoperitoneum, we'll set it to 12 to 15. The air seal is optional, but definitely if you have access to it, something to consider. In this case, I went with a midline incision. Here's a photo of what the platform looks like when it's brought in and docked, and here's it under action. Once I have pneumoperitoneum and I'm intra-abdominal at this point in the case. So whether it's the multi-port or the SP port, I do this in a similar fashion, a medial to lateral dissection. When I'm doing the medial dissection, I'm tenting up the ileocolic pedicle. I'm identifying the duodenum before I'm using any heat or energy. And it's important in terms of specific details for the SP, I have the camera positioned below right now. So my instruments are coming from above the camera. I have the camera cobraed so as to not clash with the instruments. And so my left arm, or my 9 o'clock arm right now, is doing the retraction or exposure lifting up on the cecum or the ileocolic pedicle or that fat pad. And then I'm using my 12 o'clock and my 3 o'clock arm to do the majority of the exposure and the dissection. Again, going in a medial to lateral fashion. You see the duodenum on the bottom right of the screen. I like to have bipolar when I'm doing these cases in case I get into any substantial bleeding that can't be taken care of with a monopolar. I think it's also important if you have access to it and if you could prepare ahead of time for the transabdominal cases, especially the colectomies, especially for patients with higher BMIs. Extended range instruments are quite helpful. It gives a greater range of articulation and exposure. So I'm just going to keep working cranially, headed towards the transverse colon, going until I see the hepatic lobe on the right side. Just nice and slow, getting that duodenum down, leaving those retroperitoneal attachments intact if I can. I would say if you're gonna do one of these cases, patient selection for maybe the first one, try to go for a lower BMI patient if possible, just until you really get the hang of it. So I've gone all the way laterally, and you'll see me start to take down the white line of Tolt from the medial side. I try to save some of this for the very end of the case. I think it's very helpful in terms of having an extra layer of retraction. So now I'm going to switch over and start to take the greater omentum off of the transverse colon. It's funny, I don't show it in this video, but typically when I switch over to this part of the case, what I'll actually do is a 180 rotation where I switch the camera from below to camera above, and I have my instruments coming from below. Usually once I'm done with the medial dissection of the case, that's when I do that transition, but I haven't done it quite yet here. Probably because I was chugging along and I didn't run into any exposure issues quite yet. You know what's great about the SP robot is I could advance the whole platform in quite a bit. So if I wanted to get above the right lobe of the liver, I could do so. You know, this is regional surgery, but I could also work in all four quadrants, so I could simply change the way that the platform is pointed and switch over to work on the splenic flexure or even the left colon right now if I really needed to. So now I'm going to work on that terminal ileum to free the mesentery off of the right pelvic sidewall. This will help with my mobilization for when I need to do my anastomosis. Making care to identify and preserve the iliacs, the right ureter, keep everything in the retroperitoneum down. Carrying my dissection laterally, going up the ascending colon to try to match my two edges of dissection points. So the SP robot doesn't have a vessel sealer quite yet, but I think they're working on it, so hopefully by the end of this year or maybe even 2027, they'll have a vessel sealer for the SP robot. In the meantime, you could use a laparoscopic ligature to help complete your dissection. Here I am using laparoscopic ligature, or my bedside assist is rather, to take some of the mesentery or the blood supply. You could also use a vascular load stapler. I do everything through the SP port, so it's truly single incision. However, you certainly can do an accessory port, which may be a little bit more ergonomic and a little bit easier on your bedside assist. Now there's some attachments that I'm just not seeing. I want to get a little bit better exposure, so I'm finally going to switch the camera above. So what you're going to see here is I'm going to put all my instruments in a very safe spot right there. I'm going to straighten out the camera, then I'm going to do a full 180 right intra-abdominally. And when I do that, I now have my camera working above. I push the button, my instruments are below, I cobra up, and this just changed my field of view. So hopefully I could get better exposure to what I'm left to do. So in this video, once I've mobilized those last little tendrils, what you'll see is that I have a fully mobilized right colon. This is one of the first colectomies I did on the SP, so I don't think this was an extra-corporeal. I'll show that in a subsequent video, how to do a SP right colectomy with an extra-corporeal anastomosis. But hopefully this is helpful for, how to do your setup, what instruments would be a good idea to use, patient positioning, how to point your robot, what platform to use, things of that nature. I hope you found this educational and somewhat useful. Thank you all for watching, and stay tuned for more SP videos to come. Thank you.